Hey, Mary.
Hi, everyone. Thank you so much for joining us this evening for the Cannabis Industry Meetup. Tonight, we're going to be talking about processing. But first, etiquette, please keep yourself muted and put questions in the chat. And to start us off is Zack Sarkis of New York Hemp Lab.
Hey there, everyone. Welcome. Good to see familiar faces on here. Excited for today's conversation. So we're entering into the next step of the conversation, the supply chain from seed to sale. So we started with the overview a couple of months back. Last month, we talked about cultivation. And now we are lucky to have my friend Brian, who has really been in the trenches with regards to building out a processing facility and understanding the compliance required to operate within that space. Brian and I go back a few years now. I had the pleasure to participate in one of his podcasts from Hempletics, as well as helping and connecting with their business in the initial stages of development as I was working on cultivation side of things, and they're a processor. So we've done business together and have pointed some folks in their direction. And Brian operates a processing manufacturing space up here in Rochester, New York. Like I said, he's very, very well versed in the compliance aspect and the build out of what it takes to build a New York State and now nationally compliant CBD and eventually THC processing and manufacturing facility. So Brian's his experience is second to none. He's been really working as all in as anyone. I'd consider him my equivalent, where I'm working like a dog out in the field. He's been really, really laboring away on launching his business in the manufacturing space. So his insight is really it's invaluable, and it's going to be very real and help us really understand, like, what does it take to operate in the realm of compliance up to code? What does it look like to be a processor? What does that even mean? So we're really lucky to have Brian here today. And yeah, Brian, take it away.
Hey guys, thank you very much, Jennifer, Zach, and hello, Mary. I didn't get to say hello before. I just want to say thank you to everybody. Zach really educated me in the beginning. I'm going to be very frank with everybody. He helped me bring me in and understand a lot when I was first creating my podcast and trying to learn about the whole cannabis industry. So Zach, to me, is someone that I always will lean to ask advice from, or to make sure I check myself a little bit, because this industry moves fast and there's a lot of changes, and it could be easy to make enemies friends or changes and with the challenges. But Zach and I have weathered all of this to the point now where we're really concerned about making sure everybody else is strong in this industry. So I just want to give Zach the kudos for that. And I love the library system and Jennifer for what she's doing, because that's we couldn't do it without what's happening now. Jennifer, are you going to control my slide presentation, or is it going to be from my computer? I didn't ask earlier how that's working.
Oh, sorry. Yeah, I'm going to allow you to share and you can drive.
All right. And let's see if I can make this look right. Everybody, I am not the expert on IT, so I'm going to do my best to show my slideshow. All right, here we go. Everybody can see that okay? Are we good, Zach?
Nope, we don't see it yet.
Nope, not yet.
All right, I just got it on my screen, so this should be interesting.
So in the Zoom app, there's going to be a thing that says share screen.
Gotcha, we're good.
That little green thing, yep. Green button. There you go.
Amen.
Perfect.
Show play from start. We good?
And just do slideshow. Perfect. Thank you.
Okay. Thank you, everybody. Sorry about that. I learned something new. So I'm going to start right from the beginning, because I'm not sure who my audience is. I want to make sure I'm talking to anybody who could be a retailer, potential grower, or a potential processor. There's not many people want to be potential processors, so I don't want to be boring and green and boring for everybody. So the first thing I want to give is my background. I am a journalism major by trade. I have a communication background, journalism background. I wrote for the Palladium Times daily newspaper in Oswego for several years. Then I was also a writer, editor, and paginated. So I laid out pages for Messenger Post newspapers here in Rochester. So I've worked for all the weeklies here in Rochester as well. And basically I've covered everything from sports, general news. But basically what I do is I got a great understanding of root-based questioning. So I'm very good at understanding the who, what, why of things and getting to the root of problems. I then followed that up with a newspaper career of 12 years to an 18-year career with the U.S. Postal Service. And with them, I was basically in management. So I've worked for delivery management. I've worked in processing centers. I created a brand new processing center that ran priority mail here out of Rochester, New York, that is now a 24/7 facility and one of the biggest in the country. I helped write the first we call them best practices then for that facility, which basically means we wrote all the policies of make sure that facility is running as efficient as it could. Then I moved into delivery, and then the last 3 years in the post office, I worked in sales. So I understood marketing with direct mail, and I also understood how to help companies with shipping. So I would go in and I would make sure that they were saving the money they could with the Postal Service. And this is a free service the Postal Service provides for people. It's changed a little bit now since I've been on the Postal Service, but it was a great resource where I helped a lot of businesses here in Rochester save some money. I also I love direct mail and marketing, which is a big piece of what I used to do. So within the Postal Service, I was a project manager. They basically loved to send me to different buildings, and I would go there, clean it up, take all the files out nobody needed anymore, made sure everything was set up right, and then they send me out to my next project. So I was mostly a project manager under the operations team. So now I've moved on from the sales team. I met some guys that have a large company throughout the country. They do a nicotine vape business called Bad Drip, and we've made a sister company called No Wave out of it. So who we are, No Wave, we're located here in Rochester, New York. We're a CGMP certified cannabis processing facility. We specialize in processing, co-packing, private labeling, custom formulations, and lab testing.
Sorry, Brian. Not to interrupt, but please explain all of your acronyms.
I certainly am going to spell them all out, 100%.
Thank you.
Spend some time, 100%. So we're located across from the Greater Rochester International Airport. Again, we're GMP certified for 3 years and in-house HPLC and particle size testing. Now I'm going to break down all the terms here for you guys. The CGMP I'll go through in the next slide. So first we'll talk about we specialize in processing. So what we process is we actually have purchased biomass from New York State. We have put it through a process of ethanol. And what that does is it removes out the oils from the rest of the plant, cleans the plant out, and we take those oils from the plant with the ethanol. And then we go through a 2 to 3 stage process where we remove that ethanol. So we have the oils left, and eventually we get it down to distillate. So we put that through a falling film process, extraction process, falling film, and then the distillate process. So we have created several hundred kilos of distillate here in Rochester, New York. Still for sale right now for anybody who's looking for CBD full spectrum distillate. We have some available. So that's the processing side. So co-packing and private labeling, that basically what we'll do is, let's say, we'll use Zach as an example. Zach wants to make some chewables, and we call them chewables, not gummies everywhere, and everybody. So that's part of the deal is that with New York State and the licensing, we have to be very careful how we label everything we're going to put out as products. So the word chewable is what we've assigned what everybody usually calls gummies, because gummies are kind of referred to by children and families, and we've tried to change that. And you'll understand a little bit better when I explain GMP to you a little bit more. So that what we would do is Zach would come to us and say, hey, we want to make some chewables. We would agree with a figure. We would decide where we're going to source the distillate. Usually it's ours. We decide how much we're going to charge him a bottle for that. He would then design a label for that bottle. We would possibly work together in marketing, possibly work together with distribution. We'd create those bottles for him. He would then take them out and sell them at his store through his distribution. If that makes sense for everybody. So we do that for about 30 companies or 35 companies right now. We actually make products for. Some of those products include lotions, balms, tinctures, chewables, pre-rolls. We also have flour, CBD flour in different denominations that we can do for people. In addition, we can do cartridges on site as well, and capsule filling. So there's several other product lines we're working on. We also have a pet line that will be coming out within the month, rough days. So when I say custom formulations, if someone wants to come to us and let's say they want to formulate a brand new bomb stick, whether that bomb stick is a muscle relaxer or we actually have a company that wanted to have one that repels insects. So we made an insect bomb stick with CBD in it recently. We'll be releasing that to their company within a month or so. And then lab testing. This is a big piece. I'm not going to get into this because we're going to talk about this further. But lab testing, to me, is one of the most important aspects of this industry, especially when it comes to compliance. Zach, you've been running the everything for the events for the cannabis events. How important is testing out into the consumers right now and having good tested products?
I mean, it's a lot of people are interested and desire that. I think one of the most interesting thing I'm seeing out in the public is the demand for local products first and foremost as a foundation, and then testing is kind of like a secondary thought in particular audiences. Now, the flower audience, flower market, of course, everyone cares. They want to know there's no poison in their products. But then if you go into like the tincture realm, people seem to be very sensitive to the testing and third-party stuff, and like it's kind of like different product lines have different target audiences, I think, that have different expectations. And no matter what, we know New York State is trying to set precedent for the highest quality standards in the country. And that kind of funnels us into a particular direction regardless.
Yeah, that's correct. And we as a company really thought about this. We started in about 2018, where we actually sat and we ordered CBD products from across the whole country. So we wanted to sample everything to see what was out there. We knew there was going to be a bubble in the market, and then that market was going to reduce, and only the best marketed products and the best quality products were then going to prevail. So we want to make sure we were on the good side of that. We didn't want to go into this industry thinking we're just going to go in and make a lot of money, because that wasn't sensible. So what we did was we built our extraction line, and we built our testing along with it that we can do in-house to make sure we're making quality products on a daily basis. So we knew the GMP was an important way to do that. We knew it would cost us more money to do that. It's going to take a lot more time and energy. But as far as New York State goes, for instance, Zach, you know, out of California, some of the stories. I know there's a guy that actually makes a product out of a storage container in California and distributes it to dispensaries. I love the kid. He's a friend of mine. I trust that he's making the stuff right. But without having that GMP, how comfortable are you as a producer or as a buyer or consumer of buying that? That's the question. So the state, as Zach said, has decided to put a certain threshold for all processors. So that threshold, very boringly, is the CGMP, the S21 CFR Part 111. CGMP practice in manufacturing, packaging, labeling, or holding operations for dietary supplements. All right, that's a mouthful. At the end of the day, when you are CGMP certified, you can make any kind of products that can go ultimately in a pharmacy. That's the best way I like to describe it to people. What makes a GMP certified facility? I'm going to read this boring stuff off the slide, but then I'm going to tell you a little bit about what it really means inside of this building. So GMP, good manufacturing practices. And this is required in many industries. We're not the only industry. They're required in order to conform to the guidelines recommended by agencies that control the authorization and licensing of the manufacture and sale of food and beverages, cosmetics, pharmaceutical products, dietary supplements, and medical devices. All right, what's the catch to this, Zach? I'd like to bring this up right away. What's the problem with New York making us be to this GMP level? It's the FDA, right?
Mm-hmm.
So when I first wanted to learn about GMP, everybody, I was as green as probably most of the people in the seats that are watching this right now. This is crazy. This is a lot of information. This is overwhelming. The first thing I did was Google CGMP. The second thing I Googled was the quality control metrics that go behind it, because I haven't set up a GMP program before, and I'm doing it from scratch in my new business with my new business partners. So I knew from the Postal Service and compliance that I've always been in, there's a certain structure to things. Anybody can do this structure, folks. I'm not at all smarter than anybody listening to this right now. I'm going to tell you that right now. I'm a numbskull when it comes to some stuff. But what I do is I research vehemently, and I make sure I ask a lot of questions of a lot of people. And that's what I want to put out there for you too. If there's any questions that pop through, Zach, make sure you stop me to answer them. And if anybody has any questions, please stop me automatically or put them in, because I want to make sure this is a back and forth. So I'm making sure this presentation matches to who I'm talking to. The guidelines provide minimum requirements that a manufacturer has to meet to ensure their products are consistently and high in quality from batch to batch for their intended use. That batch to batch is very critical, everybody, especially when we talk about chewables or any kind of edible products going into people's bodies. So if something that's going to have a flame or fire to it is treated a little bit differently than something that's going to be consumed by a human. So if we're talking about drinks or chewables, or if we're talking about capsules, you want to make sure there's no hair in there, right? You want to make sure this wasn't made on your home kitchen where your cat jumped up on the counter and then jumped off the counter again, and you might have something in there. I have a legacy friend of mine who was moving some product to someone and had to return to him because there was dog hair in the product. Like that's stuff that New York State's not going to want to see. So that's really what the basis is why GMP is there, is to make sure that everything is consistent. Because at all these pop-ups I go to, I have a lot of conversations with people that I want to help, that I want to work on testing with. And the first thing I always ask is, how many milligrams is in that? Not very often does it match. And it's not that everybody doesn't want to match, but it's very difficult to match. So for instance, our CBD products, we've started in 2018. Zach, were you there for our first? We started in the back of a kitchen of a retail space on Buffalo Road. Did you ever see that, Zach? We had seriously 600 square feet, guys, that we were making CBD products in. Under the GMP, we are already GMP certified. So it doesn't matter the size of your space. It doesn't matter. All it matters is it's clean and you're documenting everything. Really, those are the two biggest pieces of it. So we started in that small space, and it took us a year to perfect the right milligram per chewable. I mean, because there's three things that affect what you're putting in your products, everybody. It's heat, it's the speed rate that it can be mixed at, and if any light hits your product, that can affect it. So for instance, if you see a water bottle at a store that says it's 25 milligrams CBD, and it is in a regular plastic bottle that's not amber, that's not blocked of that UV light, more than likely that CBD is out of that CBD bottle. That thing is denigrated, and that milligram percentage really can't be the same because that UV light will actually denigrate it. So this is why GMP needs to be in there, because you got to be able to trust that if someone's making a juice or making something, that you have all the things, you know what lot numbers are going into that. That person can pull that batch out and they can recall it if there's something wrong. So the main purpose,
Brian, sorry to interrupt. Total like non sequitur, but could you very briefly discuss your educational background?
Oh, yes. Thank you.
Because probably a lot of people on the call are like, oh my goodness, do I have to have a degree in biology or chemistry? This sounds awfully complicated.
I want to get into it later, but I'm going to touch on that right now, Jennifer, because it's important.
Okay.
A piece of GMP.
Oh, you muted yourself, Brian.
Oh, hold on. Wait, I'm trying. Oh, asked to unmute. Nope. Gotcha. Brian, there you go. Okay. Sorry.
You're good. It's a great question, Jennifer, and a good time to talk about it. A piece of your audit is to validate the educational background and experience of all of your employees. That is actually a piece of your audit. So I couldn't be the compliance officer. For instance, I talked with my auditors for my GMP, and because I do have a background in journalism, a background in root cause analysis, and with the Postal Service, I have a very detailed resume of what I've done for them and the procedural stuff that I can actually like qualify as a quality control person, because I've done those metrics within the Postal Service. You don't have to have, so my degree is in communications and journalism, everybody. So she's right. You don't have to have a chemistry degree or biology degree. But if you are going to start a processing facility, I recommend we do have a chemist on site. We have two chemists that we work with. One is a full-time chemist, and one we use as a liaison right now. And one is an analytical chemist, and one is a formulation chemist. And the two of them control all of our testing and all of our formulations, and they help us with our quality control. And they're really who give us our thumbs up on what you need to have to ensure that what you're documenting really is validated by someone. You can't pull three people off the street that have never done any quality control checks and say, this is my quality control team. There has to be something better, but it can be just as much experience as through education. But that will be part of your audit, and it actually is a question on the audit. Great question, Jennifer. If it wasn't for my background in the Postal Service, I don't know that I definitely would qualify in all ways. All right, so, right, I am moving way too ahead here. And then GMP is typically ensured through the effective use of a quality management system. And we'll talk about the quality management. And I just want to show you guys the audit as we move to the next phase. So this is actually a copy of our audit where we got back for this year. So you see we got the audit date, the expiration date, the certification number, all of this is filed, and then it is sent to the state. So they actually have this as well. So we get an audit score. If you guys see that, the audit type is dietary supplements. That's the level of the audit. This is, I believe, maybe you can help me with this, and Zach, I think this is the highest rated GMP rating. There is 3 other certifications less than this. I believe it starts at the kitchen audit. There's 2 others, but this is the most extreme. Is that right, Zach, or do you know that to be different?
Yeah, I can't remember what the other 2 are off the top of my head, but the CFR 111 is definitely at the top of the list, if not number 1.
So that audit score 97, what does that mean? Like, what earned me this piece of paper? I call it my Super Bowl every year. So basically, every year I got a guy in my building for 8 hours who tears apart every piece of my documentation. He will look at how I clean my mops. He will look at and see that my SOP is correct. He will look to see if every lot number is listed for every ingredient, for every batch we've made. He actually will pull employees into an office and interview them and make sure they understand the SOPs that they've signed off on. That's the audit itself, right? So that's my Super Bowl day. So every day leading up to that day, I tell everybody at work, this makes my Super Bowl day easy when we do everything right every day. And that means it's really engaging every day. And part of the weakest part for me was understanding the quality control aspect of it, because my business partner and I had never dealt with food before. They've dealt with the vape industry. So definitely things could be consumed by people, but not in food, which is different. And GMP is a lot more standardized and strict that way. So first I want to talk about the quality control piece of it before I dig in more of what an audit looks like, because this is a piece I think people need to look up themselves. So the HACCP and food handling. So the HACCP is actually derived in a standard by the FDA, which is the first place I read it. So if you go to the FDA, there is a whole boring monologue on there, if anybody wants to read it, about how this quality control plan is tied with the FDA and why this is so important. I'm not putting any of that out there to you guys today. I'm saving you all that nonsense. So I try to give you some basics of it. So the HACCP stands for Hazard Analysis and Critical Control Point. It's an internationally recognized system for reducing the risks of safety hazards in food. Can't state it any simpler than that, everybody. It requires a potential hazard identified and controlled at specific points in the process. This includes biological, chemical, or physical hazards. Any company involved in the manufacturing, processing, or handling of food products can use this to minimize or eliminate food safety hazards in their product. It seems simple. It really is. It means basically you're tracking everything by day. And then you have double checks to what you're tracking. There's a little redundancy, but if you talk to a consultant or talk to someone who's in this industry, or you have really a good auditor who wants to work with you to make sure that everything is on board correctly, you can actually create these documents yourself. And I'm going to give you the basics today of what they are. So first of all, GMP, the ability to make products. Manufacturing facilities must maintain a clean and hygienic manufacturing area, and all of that has to be recorded through documentation. Facilities must maintain controlled environmental conditions to prevent cross-contamination. So in our building, for instance, we have a HEPA clean room. So we have they're all HEPA filtered. They're replaced several times a year. It actually is negative airflow, and all of our stuff is made in that environment. So all of our employees are robed up. They have PPE on, they have hair nets on. If they have beards, they have beard nets on. Everybody's totally covered. That's the environment. So when you see the inside of my building, folks, you're seeing the inside of like a clean lab at a pharmaceutical company. That's what you see in my company. Manufacturing process must be clearly defined and controlled. This is done through SOPs. So every one of our product lines has an SOP, series of SOPs that goes with it, from the packaging, purchasing, all the way through the final creation.
What's an SOP?
What's that?
How do we define SOP?
Standard operating procedure.
Cool.
So folks, how about this? I'll give you a simple one real quick. I have microfibers because you can only use microfibers. You can't use any paper toweling in your kitchen. So anybody using paper toweling, stop. That's actually illegal to use in a kitchen making food. Why? Because your paper toweling can rip and get into that food and contaminate it. This is all the things I've learned. I love this stuff. So let's talk about standard operating procedures. My microfibers. So I have actually 5 white buckets on my floor for microfibers, oil-based, color-based, and water-based. They all have to be washed differently because if I wash the water-based micros with my oil-based ones, they're all ruined and they're all not oil-based micros, right? Because we do with MCT oil a lot in our building. And then we have 200 grade ethanol in our building that we clean with. So we have some different kind of things that we clean. So we can get very sanitary in our building. But as far as the micros, I actually have a standard operation procedure, everybody, that states where they get stored, how they get washed in the laundry, like what procedure. So my employee can just walk themselves right through that procedure, cleaning the micros properly, and then making sure they get, after they get cleaned, where they get returned to. SOPs. I love SOPs. Oh, by the way, anybody who has a GMP facility, you have to have, I believe this is actually GMP kitchen level. In your bathrooms, you have to have the instructions of how to wash your hands for your employees. These are simple little things. It's just printing off a website and laminating it and hanging it. But it's the little things that are GMP. So what I'm saying can be overwhelming to people, but if you really think about what it takes to clear that hurdle, it's a very simple process. Instructions and procedures must be written in clear and unambiguous language. I was brought up as a journalist to write to an 8th grader's vocabulary because that's kind of what the theory was back then. So I'm very good at that. I write very much to the point where my guys hate it because standard operation procedures, really, you can't assume any step in it. And my guys get tired when I'm writing an SOP over their heads because they're like, really, dude, you're going to talk about me tying my shoe right now too, Brian? Like, it's that detailed and annoying. Operators must be trained to carry out and document procedures. This is an interesting that I want to talk about. So documentation. Every SOP I have, every employee document, every cleaning document, my hazard logs, they're actually all on a master document file. So for instance, my SOPs will be labeled SOP 101 manufacturing, SOP 102 manufacturing, and it goes down. So then I have a master file of every document that I've created. And then anytime I modify those documents, I have to change the version number and state why I modified it. And then I have that on a master document. So as anybody's going to start GMP and start doing documentation, you actually want to have an Excel sheet of all the documents you create and kind of keep them in a row. If that makes sense. All right, deep breath. Zach, any questions yet?
No, you're crushing it.
Oh, I don't know if I'm crushing it. Everybody's bored. Wake up, everybody.
This is it. This is the cannabis industry, baby. It's gonna be crazy.
Yeah,
we make good gummies.
I think these are really beneficial because it's like you've been forewarned of the amount of regulatory issues and things like that. So we don't want anyone to walk into this thinking it's going to be a walk in the park. So
no, but it can be. So that's why I just want to wake everybody up for a minute. I'll get back into it, but thank you too. Because you're right, it can be overwhelming to think about, folks, but it also can be achieved. I promise you. It just really has to be achieved product line by product line, putting all the implementations in place. So records must be made manually or electronically during manufacture that demonstrate that all the steps required by the defined procedures and instructions were in fact taken, and that the quantity and quality of the food or drug was as expected. Deviations must be investigated and documented. I love this point. So I can bring this up with one document that I created in my building. It's called a fill sheet. So for every one of our product lines, I have a fill sheet that actually details the date that was filled, the date that it was created, any of the specifics about that product. So everyone's a little bit different, whether we're doing syrups or chewables or capsules, there's a separate metrics within it. We actually do bottle weights, random bottle weights to match up. We make sure that all of our stuff goes out the right number in each bottle. We verify that. We also make sure that we check on there simple things like, were the bottles sanitized before use? Yes. And then we have our SOP to prove that. And then, was all of your equipment cleaned before and after? Yes. And how do you prove that? We have our checklist to say, at the end of the previous day, everything was clean and our supervisor checked that the employee did it. Then the next day, we re-verify again. And that's on our fill sheet that both those two things are done. So while this seems tedious, one sheet kind of fills everything for that one line, if that makes sense for everybody. And then if there are deviations, so let's say we made a 20 tray run of our chewables, but we got maybe 10 bottles less than we expected. So now the person filling and the person who created, we have a conversation. We say, oh, when we were sugaring, there were about 15 of the chewables that weren't to our high standard, or there was about 10 bottles with the chewables that had marks from the grate, because we use a metal stainless grate sometimes to put the chewables on. So if there was marks on there, we would say, okay, those weren't good enough, and we marked those as waste. So we actually record that on our fill sheet. So our fill sheet will be reflective of, we will know within a certain amount of bottles or units how close we are. If not, we actually have on that sheet why it isn't, if that makes sense. Records of manufacturing, including distribution. So this is that whole seed to sale thing. So technically in my building, I'll put this in perspective for you, that original biomass that we purchased can be tracked all the way through the extraction process to the actual distillate, kilo of distillate that it finished up in. And then that kilo of distillate can be tracked through our product line. So let's say we use that distillate to go into our chewables. We've been talking that anyways. We can actually track that actual plant that went through the chewable all the way to the end product that goes out. And then we can track where we distributed that to and our shipping area, if that makes sense. That is a true seed to sale being able to track. A system must be in place for recalling any batch from sale or supply. That's actually huge. We actually have one document that's just on foodborne illness policy required by the GMP. And my foodborne illness policy is on every phone in my facility. So if anybody handles a call of a customer that has an issue or some kind of, heaven forbid, someone got sick from a product or thinks that our product would be one that they got sick from, we have a full phone number list and SOP in place that every employee actually can see next to any physical phone in our building. And that's above what we need to do, because that's how we are so customer service centric at our facility. And we also give out a lot of samples at our facility. We're very much that people want it. We want people to experience CBD and understand what CBD can do for their body. And the only way you can do that is to giving it to them, because not everybody wants to go out and buy a bottle of 30 CBD chewables when they really want the THC maybe, and everybody's waiting for the recreation game. But there is a value to certain CBD products. CBN, for instance, is great for sleep. CBG is great for focus. Those have nothing to do with THC, folks, but they actually can help you out just as much. So that's the recalling batch. We don't take that. I am proud to say up until this day, we have never had to recall a batch. We are very prideful of that. Complaints about marketed products must be examined. The cause of quality effects must be investigated, and proper measures must be taken with respect to defective products in order to prevent reoccurrence. I have a perfect example of this in our own building. So we actually do a, what do I call it? I apologize, the name is accepting me, but I basically do a full review of any complaints or anything. So we found that we had perforated stickers that we were putting on our tincture tubes that we produce. And those perforations were a little bit weak. So sometimes after shipping, it would get to the retail location and those would be torn. And we found it was actually, the bottle wasn't tainted, nothing was wrong. It was just, that was a very poorly created label. So we discontinued that label, bought a new label without the perforations. I wrote a whole review on it. It was a 1-page, this is the issue, this is how we found out this was the issue, this is how we resolved it, and this is what we did moving forward. So anybody that comes to my facility can say, oh, do you guys actually deal with any customer complaints? We actually have a log that's kept by our customer service representative up front, and then we follow it through with codes and everything. Any questions? Back to the HACCP, because I talked about the fill sheets, but there's actually several things we do in-house to make sure our batches are good. So I talked about the word HPLC earlier. I apologize I didn't expound on it, but this is where I'm going to add this to here. So the HACCP, just to refocus again, this is obviously just the control quality system we're talking about that you put in place to protect yourself from making bad products. So implementing this system requires that both prerequisite programs and quality control plans are implemented. So we have a quality control plan, for instance, with the biomass that comes into our facility. We review it all, then we break it down. And then we'll actually measure by SAC how much stems come out, how much material comes out that wasn't used into our into the extraction side of it, so we can know how much waste was in there. And then we can build that out. And then through the quality control checks, we're actually looking now for any mold, any mildew, any spider mites, any of that stuff. And that's all going to be recorded on our documentation with that. And then let's move forward. So our HPLC, that's our lab. We also do particle testing. So every single batch of chewables made in our facility are tested daily. So if I make 400 bottles today, that thing's going on our HPLC. We know if that's to our target potency. So there's basically 3 main instruments you need to do all your testing. And this is where I should take a second here and talk about testing. Testing is the most biggest expense. It doesn't have anything to do with GMP, but it's a very large expense as far as batching. So how you create your facility and you purchase your ingredients for your products is very important. You want to limit your batch numbers as much as possible. You want to buy big batches of as much as possible. So everybody says, I only know if I'm going to sell 500. That's great, but if let's take tinctures for instance. We bought a large supply of MCT oil up front, so we could have that same batch and lot number for all of our tinctures, and it saves us a little bit on our testing side. Full panel tests are about $700. That's third-party full panel testing. I don't want to get into sample prep. We'll get into that in a minute. First, let's talk about what we do in-house. We do 1/3 of that in-house to validate what we're going to send out is going to match with our third-party tester. So we have an HPLC on site, and what that test is, we have bought, I think we're up to 16 standards. So we can test for 16 different cannabinoids, and then we can see if it is within tolerance, right? So the state gives us a plus or minus 20% of our products. So let's make this very easy for you guys. I got a 25 milligram chewable gummy. When I send that to a third-party test, it is required that that gummy is either 20% higher than 25 milligrams or 20% lower, and I'm good as a manufacturer. It was 10% plus or minus prior to the last iteration of rules for the hemp, and they switched it to 20%, which I think is fair because, like I've told you all, it took us a year to perfect making chewables, and anybody in their houses right now making edibles, trust me, this is very difficult to achieve, and I'm sure most of you aren't, and I know you're trying hard. It has nothing to do with how you're trying. It's hotspots. Batch hotspots are so difficult. So back to testing. So we do HPLC. So what we do is we will then take a random sample and we will put it on our HPLC. So I know if I'm within that plus or minus 20%, but in-house, we actually have a metric and it's in our GMP SOPs that we're within plus or minus 10% of every test. That means I have some wiggle room for my third party, but right now in-house, I'm proud to say that we are within 5% of our goal on every single product we have processed, and we're within 3% of our in-house testing with our third-party lab. That is so huge, folks, because we use no animal products in our chewables. So we use fruit pectin. Fruit pectin is very difficult. I can't tell you, folks, how difficult that fruit pectin is to actually prep properly to get the right cannabinoids out of it. So we actually turned down two third-party testing labs because they wouldn't talk about sample prep with us and we weren't matching their results. We felt our results were very good in-house and they weren't. So we asked them about the sample prep because you can use different solvents to prep your samples, which could degrade what you have there or it could make it look like it's a spike. So both those two labs wouldn't talk about us about prep. So we moved to a third lab who would talk to us about sample prep. So now we have actually SOPs with a third-party lab where the two of them match. So we know everything in-house we're testing is the same as how they're testing, and we can make sure our products are quality and match. That is so important. And it took us really the first 8 months of starting as a company to understand all of this. So I hope that helps you guys to get through that. Finding a good third-party testing lab that you can trust and have a relationship with is huge. I cannot tell you how important that is. And then the Haccp, I want to get off this. These plans are prepared for each process or product. That's what I told you guys before. You identify possible hazards and controls. For instance, a possible hazard of making a tincture would be that the tincture was actually not filled to the actual 30 mils. So you put controls in place to make sure each one is weighed, or that you have a tool that you're actually making sure 30 mils is put out every single time. And then the last thing is why use an Haccp system. Awareness of foodborne illness is increasing and concern throughout the industry is driving the use of these certificated programs. I know she's sending this slide presentation out, so I did not put this slide in there for it to read to you guys, but these are the 7 basic functions of what an HACCP plan and why there is. I'm not going to go into each one because I'm kind of going through that now. This is the biggest thing. So let's say you're going to have a farm and you want to have a small processing room for that farm. Zach, want to go with that premise with me? And then we'll kind of go through this with them, because I feel like that's going to be the most of our audience right now, right?
Yep.
So your first steps to creating a successful GMP audit and a successful GMP facility, let's say a 500 square foot room that you want to process your cannabis to be able to sell at a dispensary. Because to me, I think that is the thing farmers are going to miss out on that they can do. So the first thing you gotta do is meet and plan. You get your team together, understand how this track and trace system is going to work, and understand how you're going to have to identify each of your plants in the ground, and then make sure it's going to be able to follow through. You want to understand that, and you're going to have to create documentation to supplement that. So the first thing you want to do is start creating those small SOPs or your documentation. So how about your employee health plan you're going to create? You're going to create your SOPs on your cleaning. You can do these basic things without even being in the industry yet, folks. And let me pull up some of mine here so I can get some basics here for you guys. I know it's not exactly my facility. So some of the other things that we could be talking about are understanding a vendor list. So you can't purchase anything from a vendor without them being an approved vendor. You determine who approved vendor is, but you can't, when your auditor comes in that day and he says, why are they approved vendor? You go, hey, it's so-and-so's uncle and we're trying to help them out. That ain't working in this environment, everybody. What you need is an approved vendor list and contractor list. So you might as well start those Excel spreadsheets now. So any person that's going to step in your facility to do any kind of work, you want to list them out there, get all of their information, get all of their insurance information, and have them listed as your contractor and your approved contractors.
Sorry, Brian, is that approved by the state of New York?
Nope, it's your internal approvals, but remember, you're going to be validated through your GMP audit anytime someone from the state comes in. Make sense?
Yeah.
Okay. Because it's really that simple, guys. And this is what I want to tell everybody right now. Audits are subjective. It is based on the person who walks in your door. Generally speaking, auditors are not going to be racist. They're not going to want to, them and their company want to continue to work with you. Okay, so they don't want to come in to find anything, but they're not going to cover anything up to put themselves in a situation where they lose their certification. I hope that makes sense for everybody, right? So you don't have to worry about an audit of someone coming in trying to find things to beat you up about. They actually will give you, I'm going to show you here in a slide or two, a spreadsheet that goes through the whole audit that actually leaves a spot for you to say what you're putting to fill that audit spot. So they want you to be successful, and they're going to spell it out for you folks before you even walk in the door. So meeting and planning, this is all about trying to understand what business you're going to develop and what's your model, right? And then you're going to start creating documentation. You just start documenting the fact of what those documents are and keep them in one place, whether it's a server or whether it's Google Drive, whatever you're going to use. Identify third-party testing lab and discuss sample preparation. I mentioned that a few minutes ago. This is the most important part. This can really cause people, everybody's going to want to hustle to get products to market, everybody. But we have to remember one thing, everything has to be grown. It has to be processed. It has to be made into products. Then it has to be tested in there. Now, testing alone is 10 to 14 days. That's mailing it in. That's making sure the third-party lab is doing it. It came out clean, come back. You're going to be sitting on product for 10 to 14 days just waiting for that test to come back. Develop general SOPs for the site. I've just mentioned this. I'll keep mentioning cleaning, maintenance. I can't even tell you how many things. Oh, good. I got my document master right here. I apologize. I'm not looking at everybody. I'm going to go through some of my SOP names for everybody. So for instance, I have acronyms in departments. I have SOPs for my kitchen, for my production room, for my shipping receiving room, for my laboratory, for my warehouse. I have SOPs for cleaning. I have my employee SOPs. I have my health and safety program document. And I have an employee training document, which is a PowerPoint that's given everybody yearly. And then it's modified for any additional product lines. And what I have is basically a very simple Excel sheet that just lists out each document down, and then I just keep it under each room. So it makes it easier to organize the SOPs, if that makes sense for everybody. Develop a quality control plan for each product line. That is basically saying this can be biological. So some of the things they would say in an audit, for instance, would be what checks are you doing to make sure there's no bacteria in that product visually? Well, you can actually visually inspect something and see if there's any bacteria in it. There's things that you can do. We also have refractometers on site, so we check for moisture content, and then our third-party testing. And then what we do is we get good sourced ingredients with MSDSs. That's the other thing you need, an MSDS book for all of your cleaning supplies in your building, but a separate MSDS book for every ingredient that comes in your facility. That has to be updated at all times. If they come in and see that you have an ingredient on site and you don't have the MSDS for it, that's a gig. Again, next thing you want to do, you begin to develop a list of approved vendors and contractors. You have to start that right away. So for vendors, this is what I do. I've created a survey that I have to send out. And I learned about these surveys because when I was starting to try to get CBD products to learn about the industry, I was given some of these vendor sheets to fill out myself. So that's where I've kind of learned about them. So I found one that was online that I liked, modified it for us. You don't have to reinvent the wheel for all of this, everybody. A lot of this stuff is already online at different resources. So you want to get that approved vendor list. For instance, you don't want to source, more likely you want to source your terpenes from a place like Abstracts or a very well-known place. If it's someone new to the industry, because there's a lot of new terpene companies, for instance, you got to check their certifications. If they're all of a sudden just creating 2-3 terps trying to start a new company out and they don't have any certifications at all, I probably would stay away from them unless you see that they're doing it in a clean facility and you see everything, because your auditor may question you on that if there's no certifications. So what I do on my list of approver vendor list is I have the name of the vendor, all their contact information, and then I actually have a spot for all of their certifications. So if anybody questions me, if there's a company that doesn't have obvious certifications, then I'll dig deeper into that company to try and find other validation that an auditor would look for. So everything I'm doing every day is thinking about a third-party person looking over my shoulder, and that's the easiest way to work. It was easy for me to do that, folks, because in a post office environment, I don't know if many of you are aware of this, in every processing center, there's catwalks where inspectors watch people working in the postal service with separate entrances that they don't know about. So I've worked my whole career like someone's watching over my shoulder. So there's nothing new for me. And it's very easy for me to think this way. Schedule a Gmp audit in advance. ASI is a great company that is certified here in New York State. But I will tell you at cannabis.newyork.gov, there is a list of the approved Gmp auditors. I don't think one is better than another. I just know that it's always good to establish a relationship with someone, especially early on, because you want to go into it. You only show what they ask, and you want to go into it creating a relationship where you're working with the person. They want to work with you. They're not going to tell you what you have that'll fill that, but they give you enough ahead of time that really it's on you if you don't have it. It's very spelled out, and I'll show you that in a minute. Begin to source ingredients and packaging, like I said, and you want to make sure this is a very critical thing. So for instance, we do custom packaging for No Wave, and Bad Days is our product line. I'm sure some of you have seen it, but we have a very unique package line with coloring. We purchased all that packaging at once a year and a half ago with all the same lot numbers. So I don't have to deal with separate lot numbers for packaging, which is such a huge savings for me for time. So we thought that out. We begin operations with an eye on the first Gmp audit. So like I said, the minute we started, that's what we did. That's what everybody should do. We actually started with a Monroe County food safety audit, and I was certified as a Monroe County food safety manager, which by the way, in this industry, you don't have to do. The Gmp overserves all of this. So you don't have to worry about Monroe County or anything like that. Though it is good training for employees, if you want to take them someplace that you can do training and have them understand the basics of food, understanding food handling, I actually recommend sending them to the Monroe County food handler certification. Not that you need it, but it is good training in general for people to understand the different aspects of food quality and safety. Create a document master list. I already mentioned that, everybody. And then operations must be in operation 2 months before an audit. So they need to see record keeping. So if you're going to the first day, the audit, and they're coming in, it's the first day you're working, you really can't have SOPs that have been proven to work on your first day. Any questions before I move to the next slide? I don't know if I'm boring everybody or educating everybody. I guess I'll find out after.
Yeah, no questions.
All right, I see we're still good on time. I'm getting towards the end of my slide, so I'm hoping we can have some back and forth. But I do want to kind of show you, this is the GMP Master Audit Guide. So we get an Excel spreadsheet that gets sent by the company that we work with, ASI. It says at the top, very simple, GMP Master Audit Guide. And then there's category on the side. You see where it says subpart B personnel, and I'll read this one. So this is a question that will actually be on an audit that I would see. So the auditor the question may be worded a little bit differently on the audit, but with the way they word this, and then my response, what I have there should cover what they're talking about. So I'll spell this out for you. So this is what I would do sitting in my office. I would read this. The site shall have established procedures to prevent microbial contamination of the facility or product from the illness from personnel. This shall include the requirement that employees self-report any illness, infection, open sores, etc., and to report any visits to medical services or facilities related to any potential microbial illness. Supervisors shall routinely observe employees for such symptoms and ask follow-up questions as needed. So the first thing I had to teach my guys is they were always like, hey, everybody comes to work, everybody comes to work. And I came in, and when we discussed this, we understood as a group very quickly, anybody who has a fever or not feeling right, diarrhea, throwing up, something like that, they know not to be at work. There's no questions. If someone calls in sick to our facility, there's not a question whether you're sick or not, because we have a very good staff of employees that is dedicated to the success of our company, luckily, and they're very loyal, and I trust them completely, and so does my business partners. But the health and safety aspect is something we take very seriously and don't hold over employees' heads. Obviously, you guys all know what's been going on the last 2 years with COVID, and that makes this even more important. So it says no waive response. So I added that once I got the spreadsheet. And what's my response to that? How do I cover that in an audit? Well, I have my employee 02, that's my document control number, health and safety. So I would go to that document. I could click on it and bring that up for the auditor and show him how that document proves that this is good. Basically what that document says is it spells out our sick leave program for our personnel. We actually have a COVID piece in there now, or if anybody's out for COVID, that's all parceled out in there, and how many days they have to be out. So we don't play around with that. So it's very easy for me now in-house at No Wave to say, all right, this piece of the audit, I'm covered with my health and safety program. I will review that once or twice a year to make sure there's no changes that need to be made. And obviously in the last 2 years, we've had to change for the COVID. Let's go to the second part, just to give more example. The site shall have established hygienic practices that include appropriate garments, good personal hygiene practices, hand washing, and sanitization, etc. These practices should be followed prior to starting work, anytime when a person becomes soiled or contaminated. Again, in our health and safety document that I created, we have everything about personal hygiene in there. And then also I would actually bring to this auditor, when he brings this up, I would bring the fact that I have at every place where people can wash hands, I do have the instructions of how to wash your hands. When you go through our pass-throughs, we have sticky pads, and then our people actually put on clean white coats and PPE that is in a dust-free facility. So for us, these two questions are very easy to cover. And then I wanted to show you different subparts. So this is subpart C, so physical plants and grounds. So I'll just read this again. So the site shall ensure all plant grounds are properly maintained through the removal of litter and waste, cutting of grass and weeds is adjacent to the building, adjacent to the plant, maintenance of roads and parking lots, adequate draining, etc. Property contiguous to the site shall be evaluated for potential impact to the site, and if necessary, additional preventive measures shall be enacted. So this is a tricky one, and this is why I put this one in here. So landlord responsibility obviously is a piece of it, because we currently rent our facility. We have one being built for us, so it'll change this condition. And then I'll have to make an SOP and take that out once we get in the new building. And then our SOP cleaning 102 outside cleaning. So I actually have an employee that will go out and follow that SOP once a week, where he goes out and does the outside of the cleaning of the building, follows that, and then signs off that he did it. And then that's fine. It's signed off by the supervisors that was followed up on. So the landlord responsibility is a big piece here. And I want to talk about this. The site shall ensure all plant grounds are properly maintained through the removal of litter, waste, cutting of grass, and weeds adjacent to the plant. If your landlord is not taking care of business and the outside of that place looks bad, that's on you. You're not going to get past that audit because your landlord didn't do what he was supposed to do, because you, at the end of the day, you're responsible for making sure you pass that GMP audit, not the landlord. So I just want to make that clear, that we have it as landlord responsibility, but we have to really monitor it to make sure it is being adhered to, or take care of it ourselves. So I just want to put that out there, that me writing landlord responsibility there doesn't say, hey, when you come in, hey, the landlord's a piece of crap, we try, here's my record of calling him 10 times, here's my 10 emails. You're failing that spot, guys. Okay? Just remember, this is all on us. And then the site shall ensure waste treatment disposal. I added this because this is extremely important. I had to do this week. It's adequate and does not provide a source for potential contamination. There's definitely, I know Jen Metzger is really heavy on this, and we're talking about sustainability. And in this industry, there's a lot of talk here and there. In our building, we do the best. We do a pretty good job. So we track all of our ethanol waste. We actually have hired a contractor. It actually costs us more to remove our ethanol as waste than it does coming in as original ethanol. How about that, folks? It is crazy. A 270 tote costs more to send out of our building than it did to bring in our building. It definitely costs, most people don't realize, to the point where we are now segmenting our waste even further down. So the ethanol waste is really segmented from any MCT oil waste or other waste, so we can make sure we remove that stuff. So we have a full waste management plan at our facility, whether from the biomass that we're extracted from all the way down to our packaging that we throw away, if it's any damaged packaging. And then we actually track every piece of packaging. So let's talk about how crazy GMP can be here, guys. Let's say you buy a lot of 500 bottles for a chewable for a customer, and they order 500. They order 510 labels because there's always that risk of some bad labels, and then all the ingredients. So you do all your record keeping. You run through and it's like 478 bottles you finish. So you had 12 bottles left. You actually have to track that you have those 12 extra bottles in your site, and track it that it's in your site, and have it someplace on paperwork, and have really almost a quarantine hold card or placard on that to state that that's that company's bottles and that they're there and how many are left. And technically any auditor should be down to your exact inventory of everything in your building at any moment on your audit day. Any questions? You could take me off my computer now, ma'am. I don't think there's anything else I really want to bore them with.
Any
but
questions for Brian or Zach?
It's just such a clear, outline of how in-depth and engaged this business is. And we're going to see this level of in-depth engagement in the cultivation process. It's definitely a higher tier here when it comes to manufacturing, especially when we're putting food in people's bellies, for example, or in people's lungs through vapor and extraction. But no matter what, we've been saying this from the beginning, like, it is a high barrier to entry to be so organized, for lack of a better description. And I that can't be underestimated. And the simpler you can make your organizational strategy, the sooner you begin integrating that, working on it, the better, because it is going to be a big lift, and that's going to be something that breaks a lot of business models or really hurts them. So it's incredible to hear what you've done in such a short amount of time, Brian. I know I've seen you go through the aches and pains of this process. And also you have been sober in reminding us that it's feasible. It's not that it's impossible, but it is work. It's someone's full-time job to make sure everyone's dialed in this, and that's something we all have to expect.
Can you guys just explain?
I have a question.
Oh,
Please.
Sorry.
Okay, one quick question. Sorry to interrupt.
No problem, Eli, come on.
Okay, now is this just for when you're making chewables, or is this also for cannabis cultivation?
So this GMP applies to everything. I know I keep using chewables as a baseline, only because it's one product line that everybody talks about, but I could talk about this with cartridges. We do disposables and regular cartridges, but every product line, what I'm talking about, this definitely applies, especially extraction. To me, extraction is almost the most important for GMP, because you have to get your third-party audit for your biomass coming into you to make sure there's no contaminants in there, because Zach, what is the most important thing about the cannabis plant people forget? It pulls everything, wear it.
Oh yeah, it is a bioaccumulator.
Everything in the soil that plant is on, it's pulling it out of the soil and pulling it into the stalks, guys. So you got to be really careful with your third-party audits when you're a processor, not to have any pesticides or heavy metals in that biomass. You know, that's critical. Does that get to what you're asking me, Eli? I want to make sure I really expound on what you want.
Well, I was more touching bases on when you're actually growing marijuana and then actually setting it up to be sold at a dispensary or have a, you know, or sold through a dispensary, more or less.
No, you're good. So as a grower, let's say if you want to be a small grower and processor and you want to maybe do eighths and quarters and ounces or halves and ounces, right? And pre-rolls. So for you, you'd get the tracking on all the seeds, right? So Eli, each plant, they're going to give you a tag to put on each plant. And you're going to have to track that through. And then whatever biomass comes off that plant, that'll be like that barcode. And then what you'll have to do is that you'll just have to keep that plant, pull it all down and keep it as together as you can. And I don't know if they're going to allow you to, like, if you take down 3 plants together and trim them all together, if that's going to be one lot number for an extractor, or how they're going to do that differently from extracting to going straight to a dispensary. So there are some questions, Eli, but at the end of the day, you're going to want to track, for you want to track all the ingredients going into making that plant grow. Does that make sense? So you're going to have water records. You're going to have your records of your nutrients and your records of when you do everything. Does that make sense?
Yes, it does. Yes, it does.
Right.
Oh.
So for you want to track your ingredients, your water, and your water. You want to have, like, let's say you use city water. You actually can just go to the City of Rochester website and pull up their water report, and that qualifies.
Okay.
Okay. So like this could be simple. So for you want to track everything going into your plants and anything touching your plants you want to track. And then you want to have like a sheet that when you grow that stuff and you're going to start to trim it, probably some kind of trim sheet that says, my guys were wearing robes, my guys were wearing head, you know what I mean? And you write the SOP, and then you have a checklist that said, yes, we did this stuff. And another thing is, in these rooms, I'm going to tell you, this might be your biggest cost. And if anybody wants to process, if you have a hemp license now and you're going to get a provisional soon, or a real license soon, remember something, 280E is a big thing we have to think about. So we're actually been buying a bunch of stainless tables now. So we can get them as tax write-offs now, because the minute we get the license, I can't tax write off those tables. So stainless tables are huge. You can't clean wood and plastic sanitary, everybody. You can't. It can't. Even with ethanol, plastic and wood soak stuff in. I didn't realize plastic was as bad as it is, but I learned it through my GMP. Stainless is the only thing you're really going to be allowed to have in those rooms. So also, you know, that tech stuff you put on the side of kitchen walls. I'm sorry, I don't remember the name of that, but on the side of the kitchen, if you go into a GMP certified kitchen, like your first 6 feet of walls, a lot of times, like, sorry,
it's like a white board.
Yes, you know what I'm talking about, right, sir?
Exactly.
Like you want to think about that room. Probably you want to have that stuff in the first 6 feet because it's the easiest to clean. You don't want to have drywall that gets holes in it and it can't be cleaned easy, right? So, like I said, I'm just talking about a small room now where you're going to trim down, and then what you're going to do is you got to track your packaging, right? Because that's the only other thing you're bringing into the equation right now, right? So you're just trimming your weed now to put into packaging. Now you just track your packaging, make sure you tracked everything, that everybody was doing it clean to put in that packaging. And then you got to track, so what factors could be. So now you got to do a third-party test on that weed, right? And then you got to make your batch numbers for that. So you have to figure out how you're going to do your batch numbers, and the state's going to spell this out for us a little bit. So don't be too stressed about that.
Okay.
So this will be, you know, it won't be we're all doing it on ourselves.
Okay.
So you really need stainless tables, clean environment, robes, stuff for their hair, stuff for their hands, beards, and then they can trim away, making sure everything goes into a certain bin with a lot number. And then you're going to write that lot number on that bin, right? And you're going to probably want a food quality bin more than likely, or a bin that can be cleaned. Zach, correct me, because you're way more better than agriculture than me, Zach. So if I'm saying something wrong. And then at the end of the day, you can put those into final packages that can be scanned out with a track and trace system that you'll then to be able to give to a distributor or to a dispensary. I don't see anything else that prevents real good agriculture and farmers from doing that in a small space.
Okay,
Brian,
thank you.
oh, sorry, Eli. So if you could just to reiterate, if you're going into the adult use recreational market from the whole vertical, seed to sale, what needs to be tested?
So for us, we would test the distillate as we create it, because we want to make sure that before we put it into products, that distillate is clean. So we're actually going to test. So us as I'm going to go from my process perspective, and then everybody in their side of the chain can see where they need to test. So the growers have to test before they give it to the processor. So there's your first third-party test on material. Then processors, after they take it from plant matter to distillate, once they get it into either crude form or distillate form, they'll have to get a third-party test on it then. And then once you put that into a product, the final product that's created, another third-party test will go on that final product. So probably 3 times for each set of materials. I think is pretty reasonable, Jennifer. Minimal. Zach, did I miss one?
No, that's pretty standard. And it's definitely, at the point of processing is generally the biggest pain point, where you got to have tests in and you definitely got to double down on your test out. So that's the best way that I understand as well. So good overview, Brian.
Okay. The only thing I was questioning, Zach, is a grower who processes right into their packaging, can they really get away with one?
With one what? I'm sorry.
DOA.
Well, it would have to be a full panel. So we're
Or-
talking COA, terpenes, microbial, pesticides, etc. That may, as long as it's plugged directly into the system per batch, let's say a batch or a lot is 5 to 10 pounds. I have a feeling that will be allowed, especially if we're talking like the micro business or small cultivator. Yeah, that's a great question. The regulations will definitely tell us that. And what's your perspective? Do you think that they should be able to, or would you have concern?
I'm about the farmer. Okay, so every state I've seen, I think the farmers and the social equity people are the people that are getting burned.
True.
I don't know why retail is so worried about their margins when they can put, let's say I create a chewable for somebody and I charge them $10 for that bottle. They're charging $20 at the retail for that bottle, right? So
Yeah.
they got the best margins of anybody as far as I'm concerned. So my concerns are always going to be to the farmer. And I know the state is thinking that too, because if we want to keep out these big money players, that's really where our emphasis needs to be. So first I'll start with that.
I have another question following up on what you guys just said.
Please, Eli.
Okay. What is the going rate for testing? Like I know
Yeah,
that you
great. I was actually just about to get into that. That's great. Potency test for us in-house, we do potency test for people. We charge $75 because we're not a certified lab, right? So I'm not ISO 9001 certified, which your third-party testing lab has to be. So my lab can never be a third-party test lab, just so everybody's clear. Our machine is high caliber. We have the calibration. We have all the records. Our machine is accurate, but we're not third party because that's another step. But what we can do is for our in-house testing in GMP, we are above what most people do. I don't know another company in New York State that has an HPLC on site that tests their daily batches. I challenge another company to buy that because it's an expensive piece of equipment to do to make sure that your batching's right. Oh, now I got off on my tangent. I so apologize. That's the first time I lost my train of thought the whole time. Eli, remind me again what you want from me.
Okay. Like how much does it cost?
Oh, sorry. Yes. So $75 in-house for our potency, but normally it's $100 at a certified lab. It's $750, I believe, is about the going rate right now with the terpene test included. Zach might know better than me, but it's about $750 with, I think it's $700 if you don't get the terpene test. It's another $50 if you want the terpene test as well.
And
I've heard there's definitely a range. It depends on how many you do as well. So if you're, let's say I have 3 genetics I just cut down, depends on what state you're sending for, as well as what cannabinoids. So for CBD dominant, I've heard as low as 350 to 450 with a full panel, but I do imagine that we're going to see a substantial markup for THC based processing as well. And again, we're not doing this really in New York State yet, so the market has yet to define itself.
And we are, everybody, just so you're aware, if you find a good third-party testing lab, I would shop now because this is going to be the biggest bottleneck in 8 months. Luckily, we have a good relationship with one already that we've already discussed this with them. But I would make sure everybody has a good lab now on the radar.
Yeah. And Brian, do you offer your services as well as will you be giving your contact information?
My contact information I certainly will give out. I don't offer my services for payment, as Jennifer knows. I don't necessarily like that, and Zach. But I am out at a lot of events, and I like to respond. So, Eli, here's my deal. Our company, we know we're well positioned right now for what's going on with this provisional licensing, and we know I've already taken a mentorship role in the community, and I plan to continue that, and our company plans to continue that. So I do ask everybody to reach out, because I don't want to see people wasting some of the money we wasted up front, because I only believe that strengthens all of us overall, and it only strengthens all of our relationships. So yeah, I certainly, before we're done here, I will give my contact information out. I'll tell you right now, my email is brian@nowave.com, BRIAN.nowave, NOWAVE.com. That's my email. I am the compliance officer and one of the owners of my company. So I'll tell you, I get inundated with stuff, especially after provisionals were announced last month or last week. I can't tell you the amount of emails I get, but I certainly, if I can provide you a resource or if I can help you in some way, I certainly, I'm all about it, because I'm a firm believer that the stronger the farmers are, the stronger we are as processors. Because I love what the state's doing. I just want to put this out there for everybody. Anybody who doesn't like the way the state's putting out these provisionals, let's keep a couple of things in mind. Number one, there's only 17 processors in the state that are GMP certified, and we're really not going to affect the total number of social equity applicants. So let's put it out there. It's very tough for certain people to get these licenses, and we need to have facilities that are up and running to process this biomass quickly. And nobody that doesn't have a firm THC license is going to build a facility right now. So we really got to kind of, even if I took my company out of the equation, the other 18 companies, that they're needed right now to get it out quickly. As far as the farmer side of it go, I heard that there's been some pushback about that. And I just want to say, if farmers were growing CBD at a time, 2 out of the last 4 years, at a time when they couldn't make money on it, to learn and understand compliance and to be following the state guidelines and everything, I think that they actually should be rewarded to a degree, because they have played the state game, right? Like, they've paid a lot of money. I don't even want to talk about the money we've thrown, and we're building a new building right now because it's ridiculous. We spent more than we had to just with mistakes. And I know people can do it a lot better and more efficient than we have. And at the end of the day, Eli, that's my thing, is I want to help everybody else be more efficient, because then in 8 months, 12 months, we're all going to be together, really at the end of the deal, educating people on this plant and making people healthier. So let's not get away from the fact that we're not just talking about recreational marijuana, so we all can sit around and hang out with joints with our buddies around a campfire. We are actually bringing this plant in for healthy. And the reason why me and Zach met originally is when I started a podcast, because my belief is that this plant in our lives should be together more than alcohol in our lives and more than other things. And I believe if we treat that as we grow this, whether we're talking about GMP and documentation and all this stuff, let's remember that we're trying to help make people more healthy and make our society better. And I think this plant helps that.
Thank you.
Yeah, sorry it's so long-winded, Eli.
Any other questions for Brian or Zach? Mary Kruger from Rock Normal is also on the call.
Mary, just in general, are you there? She might be muted and not want to chat, so that's fine.
She's muted, but
Zach, have you heard anything around the state regarding any kind of licensing? I like to always end certain meetings with kind of giving people some information maybe that we've heard. I know I've heard that it looks like some of the licensing, some of the information could be coming out within the next 4 to 6 weeks, but it may not be everything. It may be kind of parceled out to try and make it so it grows properly, right? So the farmers in agriculture, we really need to start first, right? To get the plants in the ground, to get the genetics officially in the state. However they're going to do that, the emancipation. But from there on, I mean, we're probably talking about 8 to 10 months before seeing a dispensary, even with these provisionals. Anybody heard anything different?
No, I mean, that makes sense. Cultivators in the community have received emails saying that they may qualify. And that the initial stages for application and regulations will be released in the next couple of weeks. But you're definitely right. As cultivators, we need to know last month whether or not we're growing this year, because of how much of a workload it is and the cost, et cetera. That being said, of course, then the integration of the GMP, the extraction community, and then in turn the retail. A lot of the retail is going to be dependent on that $200 million fund through which the state's going to be empowering social equity applicants for their retail dispensaries. I do think that it's.
Sorry,
Yeah.
Zach, I just got an update on those grant funds
Please.
from Jason, and this is conjecture, but based on who he's talking to at the state level, that 200 million will not be true grants. They will be loans through what's called DASNY, the Dormitory Authority of the State of New York. And it'll be a public-private investment where they purchase real estate and then lease it to those in the cannabis business. So it wouldn't be a true grant. It wouldn't go directly to startups. It would be an opportunity for probably a low interest for a more affordable lease.
So I appreciate that insight. And one big concern is us as cultivators is hoping that some of that money, the 200 million, would qualify and be leveraged for inventory purchases, because okay, we can grow all this herb. Brian can extract all this herb, but if retailers can't purchase it up, and only the first people who have access to that only have a foot into a location, I mean, it does create complexities where, again, like bottlenecks, I guess you could say, in this whole process. So it's good to know that we're getting some clarity there, but there was definitely hope that that money would go towards not only lease agreement support, but also the infrastructure and inventory required to actually launch a business. Because if you know anything, inventory is going to be cost an arm and a leg. And this definitely isn't going to be an industry like I'm not sure there's going to be a lot of fronting in this industry at this point in time. So again, for us, there's this strange kind of conundrum that we're looking at as, let's say, mutually as processors and cultivators, where okay, as a cultivator, I'm ready to grow. I'm curious if Brian wants to buy my stuff up front. Does he have the capital, or do we have a contract? If so, what does he want? How much does he want? When does he want it? But then even so, let's just say by chance if Brian wanted to purchase, secure 5,000 pounds from me of extract, or 1,000 pounds, or 100 pounds, whatever the number is. There's two scenarios. One, he secures it by contract, or two, he's got the capital to put money down. If he puts the capital to get money down, it's a guarantee. If not, then we'll play it by ear. If he buys it, he puts the money down and he gets it, but then then Brian might be stuck with his inventory and processing if there aren't dispensaries open. And same that if he didn't buy it initially up front, then I'm sitting on my flower and Brian's waiting to purchase it from me before the dispensaries are open. So there's definitely a lot of liability here. And that being said, what I will say is no matter what we do, we cannot satiate the New York State market. We can't grow enough. We can't manufacture enough this year, even if we tried. There's probably a few years of all in, and we're not going to be able to produce enough. And so I do think that these conundrums, there's conversation about actually trying to initiate some form of is there the opportunity to also onboard limited on-site consumption? Because if you read what on-site consumption looks like, it is a very small inventory dispensary. And if there's anything that could be very well taken care of and well kept and well tracked, and I'll tell you what, there's hundreds, if not thousands, of these places all over New York already. That's a question. So it's how can more people get onboarded sooner rather than later? And it said that there needs to be 1,000 dispensaries in New York State minimum to satiate the New York State economy and market. So we're talking about maybe 1,000 or maybe 100 getting early release. Back to Brian's statement about 8 to 10 months, I would hope so, but the reality is we're hoping early Q1 and maybe. Q2 for dispensaries.
Educate me, guys, for just humor me, because I honestly don't know. So, I mean, if you had to hold on to like these 1,000 pounds, you know, before Brian could pay you for it, is there a shelf life? Like, is there?
Yeah, there's. I mean, if you store it right, it can last for a very long time. And the reality is, this year we're going maximization. And I'll be so frank that mold will be sold this year because no matter what we grow, it will be extracted because we cannot grow enough, and the demand is going to be so substantial. And I use that as a play, but it's like it is real. But yeah, how long? It depends on the environmental conditions, the temperature, the humidity, etc. But again, what even just context, it's like there's also the psychological environment. If you can't sell it, like you're asking me for the third year to go all in, I have no fucking money. I'm gonna put my whole life's work into cultivating again. Maybe you have to onboard some people for a mentorship program, which I don't know if I can pay them, let alone a livable wage. And then I don't have a market to sell it in. Like on a level, that's scarier than anything. And it's incredibly vulnerable.
This is crazy.
I mean,
he's talking about a market that's insatiable, and he still doesn't know if he can make money.
But but see here, I mean, but don't you think it's fairly likely that, you know, the black market, the illicit market is going to continue all the way up until
the legacy market will never go away.
It's never going to go away because it's cheaper and people don't, you know.
Well,
it's peer-to-peer. Peer-to-peer has always existed and will exist, especially with home grow. It's so simple. And then, but the volume of illicit market operations in New York State, like, I mean, there's millions and millions of pounds coming into the state. Most of it's out of state, and that is not going to go away. And it's a big question. That's like, you know, it's a living kind of vulnerable point in all this. It impacts legacy cultivators, local legacy cultivators. It impacts the licensed market, and it's not going away. So, you know, we have this whole, there's a lot of different layers that make this very complicated.
I mean, if you know, have smoked marijuana your entire life, and the marijuana that you've been smoking has not been tested, doesn't have any material safety data sheets attached to it, what's the sell then? What's the benefit to say, oh, well, this stuff has been tested? It's like for example, my husband is, you know, in his 40s and he smoked since he was 14, you know, and he's still alive, right? So like saying like the health and testing aspect, what's the, like, I guess for people that have been lifelong smokers, they're like, that's not even a thing. We don't even, you know.
Well, I do have an answer, and I'll say it's target audience. There is a certain subset of consumers who will feel safe and who have smoked enough poison and have had enough bad experiences with cannabis that they will drive anywhere to get some form of clean product. But again, there's going to be a large volume of people who, like, once their friends are growing, you know, it's like there's a small group of people that will do that. And then there's going to be a lot of people who are going to be excited that their friends and family are growing for home grow medical, home grow adult use, or have a bit like an arm into some business somewhere that they're able to get some cheaper local weed. You know, a lot of folks know that, like, it's local. Most people who grow locally are doing it in a very delicate, controlled manner. Most of the stuff that's coming from out of state, I can't say that. And in fact, I've seen the worst of the worst of what doesn't make it into another market that gets sent to New York. And so I do think that, again, there's going to be a certain group of people who are going to feel really safe and blessed by this like legal pathway of clean product. And there's going to be just way more local regional product that's available as well to the existing consumer base.
And Zach,
sorry about my fire.
And Zach, I would also like to piggyback off of that, and to answer your question a little bit, Jennifer, if I could. I believe once the education of mold and how mold can affect the body being smoked is it's consumed by everybody out here who is looking to buy cannabis. once they understand the problems that can result from mold, they will be looking to more go into a dispensary to make sure that it's clean rather than trying to pick up something on the street which may not be clean.
That's what we talked about earlier.
I'll say so.
I agree.
ahead.
Go ahead, Zach. I mean, real quick, there's going to be people of all of these different people. There's all of this, right? I got friends of mine that are only going to buy dispensaries. I got friends that think they only want 24% THC, and they're going to find that really a 17 or 18% is the better. So education is the real big thing here, guys. And I think you hit it on the head there, Eli. Part of it is we have to educate everybody on what bad things are out there. Because I'll tell you what, most of my friends want a 23% sativa, and most of them like an 18% indica. Like now that they see testing, they're getting educated from buying from their buddy. They didn't know any cannabinoids in there. And now all of a sudden they're going to see a piece of paper that's going to show them, how about this, Zach? There's some CBG and THC. There's some CBN and THC. Like there's some of these minors in there that really are affecting people that they didn't understand before that they are now.
Yeah, and even I'll take it, like, I'll play devil's advocate, Eli, and I am in support of everything you just said. But as an industry stakeholder and looking at other industry groups, specifically tobacco, I'm talking raw leaf tobacco, cannabis is held to a different standard of quality control than any other industry, as if it is an opioid that kills. And I'll say there is no data out there that shows smoking powdery mildew is hazardous for one's health or botrytis. Now, I'm not saying anyone should or would I ever, absolutely not. But it is interesting that, like, that's something as a cultivator, like, and as an industry that, like, we're being forced to have the highest cleanliness standards that, like, the tobacco industry, they don't even look at them. Like, you know, I'm being dead serious. So it's like
tobacco is not FDA regulated.
Well, I mean, and I guess that's where there's a challenge between, I'm talking about even THC, which technically there are synthetic cannabinoids that are regulated by the FDA, as well as cannabinoid like CBD. But it's still this tricky zone where, like, yeah, of course, like, we're talking about as cultivators, we want to actually begin to advocate for the states to conduct research to prove what happens when you combust these things, instead of us assuming that it is bad, because there isn't data. And that being said, like, yes, no mold, no powdery, like, that absolutely gets tossed. But it's this weird conundrum where, like, the state's going to make us operate under the highest standards that other industries don't have to prove.
Right.
And we're not even sure what is the actual, like, risk at
there's
hand.
really not a lot. I mean, the closest would be pharmaceutical, because again, tobacco, because of their powerful lobby, is not approved, does not have to have FDA approval, because again, they would never get FDA approval because it's a proven carcinogenic. But explain to me though, again, I'm total, my grandparents owned a greenhouse and I did not inherit any of that. If the plant is dry and exposed to light, how is mold like a problem?
So most of the mold comes through the flowering process, and it's very much I mean, it's a living plant, and this is a living world, and there's billions and trillions of microorganisms always alive around us, and there's certain conditions that allow the vulnerabilities of particular plants to be exposed, and again, powdery mildew to develop on this surface, or botrytis to begin to spore within this bud. And there's certain things that need to happen to allow that to be. But when we're talking about a dried bud, it usually happens that you harvest and then you dry and then you go into cure, but someone didn't see what was already formed out in the field, or your drying curing process was not stable. It was too much humidity. It wasn't enough motion of air that allowed what was there maybe in trace amounts to then develop a living colony. And so it's kind of like most of it's coming from the production side, but of course, if you put something in a closed box with no air that is wet, it's definitely going to mold regardless.
Okay, one last question. Have you looked at the medical literature to see how much of a problem mildew or mold from smoking cannabis is to the public health?
That's what we've been trying to research. Like there isn't actually a lot of data. If you can find any, send it my way. I'm happy to be disproven. But again,
I've been looking forward
Go
to it.
ahead.
I
Yeah. And that's why us as an industry, we're like, I'm down. Tell me, prove to me it's bad. I don't want to smoke anything bad, but there is this like expectation that we have to but we actually have no idea.
Right.
And so I
So,
hope there's some data that comes out.
yeah, so, well, I mean, I have a master's in public health, and I'm also a very good searcher of medical literature. So, I mean, it just doesn't even seem to, in the public health perspective, which again does not care about the individual, but the mass. I've never heard anyone even remotely consider that a public health concern. At
What
all.
a public health concern. I'm sorry.
Contamination from cannabis,
Precisely. I mean, I would go so far as to say we have 50 years of illicit cannabis consumption, and there
Right.
is I've never heard
There's
of
nothing.
any medical reports of someone who has suffered because they smoked. We would know if someone has suffered from powdery mildew or botrytis.
If
we
they
know there's
did,
enough
okay,
case
if
studies.
someone actually got sick and died from that, they most likely would have been probably HIV positive, and that tiny amount of mold would impact them way more. But I mean, the thing that the important thing, I mean, I'll look at it tomorrow, but we can't, you can't prove a negative, right? So if there is nothing in the medical literature, then it's not an issue, because it's not something any physicians are
all
seeing.
these years, if they could have found anything negative to help fight this, they would have. Let's think about that.
Yeah. So I mean, I would say
I don't want to downplay Eli. Like absolutely, Eli. Like I will never like. I'll have a recall line on my if there's ever any mold, powdery mildew. Like absolutely not. It doesn't make it out of the grow room. It doesn't make it through the trim room. Every step of the way, there's a culling, sorting process. And so I'm not here to promote that we should be smoking anything that is compromised, but I do want to like question the standards. Like as cultivators, they're gonna put the standard so high, so much higher than anything, and without some justification and all the costs that it's gonna put on the small cultivator specifically, without an explanation or proof, it makes one wonder. Now, again, I do think that maybe what I'm saying is raising the minimal thresholds. I'm not saying anything goes, but it's like knowing how intense and scrutinizing they will be without a lot of proof is an edge point for us.
Well, I mean, here's a comparison is like fruits and vegetables are not tested by anyone at any time. And if they give you E. coli, which can really, really kill you in a short duration, there is no testing required for that whatsoever.
How about
and
this?
that is far more
food?
deadly than.
Amen. How about foods? FDA approves things the FDA approves in foods, but not in cannabis. You ready for this? So orange oil, if you don't have an organic orange oil, don't plan on sending, if you use anything but an organic orange oil in your products, don't send them for third-party tests because it's going to hit for a pesticide on how those oranges were grown. It's gonna, no way. But in the FDA's world, in the food world, that is okay. In the cannabis world, it's a failure. True story. You have to use organic. I'm going to tell everybody right now, don't use anything but organic orange oil because there's certain pesticide they use in Florida. How about that? But if I'm eating something gummy that's for my kid, that pesticide could be in there. How about that? Yeah. The stories you see and when you do the research here, and just on first research in my podcast originally, I found the only place really to get studies is out of Israel, Jennifer. So they're the only country that I found that has the most detailed studies you can research on anything cannabis related.
That's good to know. But I also want to say, like, in terms of like children and everything, people become so ridiculously I don't even know what the word is, but the restrictions they want to place on their children you know, and it's like, it's a medical marvel that all of us have survived childhood, you know, and I feel like this is, you know, like I ate peanut butter all the time and look at me now, I'm okay. But I feel like, you know, kind of that a lot of the contamination fears are kind of out of that growth of, you know, like they want to live in a bubble.
You're right. Thank you for having me on today, guys. I do appreciate it.
Yeah,
I
that's
hope
great.
I hope
Yeah, I
I
just realized what time it is.
I try to make this upbeat but not as boring. So if anybody has any
No,
feedback
that's
on what would
great.
have been better or worse for future, please do that. Again,
Yeah.
my contact information is brian@nowave.com. That's my email address. I'm also on Instagram at Hemphletics. And I'll do my little plug that I'm sure my business partners are going to razz me about later, but I do have a podcast out, Hempletic podcast. And what I do is I just educate people about the plant. So my basic is, guys, I am a serious athlete. I'm an Ironman, couple-time Boston Marathon runner, 18-year triathlete. And I've been consuming this plant since I've been 17 through all my training and everything. So I try to educate people through the podcast. I hope you guys check it out. I got a little bit of everybody on there. So, and then lastly, Monroe County Library System and Jennifer, I just want to say thank you. And anytime you can possibly reach out, you have any questions or something I can help you with, or maybe you can help me with, please pass it on, because I think you are doing a great service for everybody here. So thank you.
Thank you so much.
Huge.
All right, everyone. We will send out the slides and the link to the YouTube recording. Have a great night, everyone.
Good night.